Good afternoon and welcome to our first Lunch and Learn of the season, Empowering Tomorrow's Nursing Workforce, Operationalizing the New Normal Through Competency-Based Workforce Development. My name is Marcia Proto and I'm the Executive Director for the Connecticut Center for Nursing Workforce, and so happy that you're able to join us today. Our session will be facilitated by Larissa Africa. Larissa is President and CEO of Versant Healthcare Competency Solutions and responsible for its strategic and operational leadership. She's instrumental in driving Versant's mission to fundamentally transform healthcare outcomes by developing the workforce ability to provide safe, efficient, competency-based care. She spent 2 decades implementing, managing, and leading strategies to develop nursing organizations. As a pioneer in the transition to practice space, she's led the deployment of competency-based models that integrate and standardize nursing workforce development across the healthcare continuum, addressing high demands areas such as long-term care, home health, and advanced practice nursing. Larissa is a fellow in the American Academy of Nursing, where she's a member of 2 expert panels, Building Healthcare System Excellence and Quality Healthcare. So without further ado, I'd like to turn the session over to my colleague, Dr. Larissa Africa.
Thank you, Marcia. Good morning, good afternoon, everybody. It's still good morning for me. I'm currently in West Covina, California. I'm so glad to be here. Thank you so much for having me. I started sharing my slides, so I just want to do a check and make sure that you all can see my screen. Marcia, can you let me know if you're seeing my screen?
Yes, perfect.
Perfect, great. So I remember having a conversation with a senior nursing student when I was a sophomore, almost 24 years ago, and she was encouraging me to work as a CNA or as a student intern as soon as possible, because she said there were very few positions available for new graduate nurses. And I remember thinking to myself, okay, now what? My decision to go into nursing was pragmatic. Nursing was going to give me a stable and secure future. So when I heard this, I questioned, gosh, well, how am I going to pay for my school loans back? And then wondered what I was going to tell my parents, since they were also helping support my education. By the time I graduated from school, though, it was a different story. There was a plethora of open positions. And that was the first time, if I remember, that I heard the term cyclical nursing shortage. You know, it seemed that every hospital near me was offering a sign-on bonus. And here we are, more than 20 years later, experiencing a similar situation. But this time around, we're facing more than just a structural shortage, right? We have some systemic challenges. In healthcare, we have a tendency to be conceptual in nature, and operationalizing strategies to transform our nursing workforce within our current environment is about focusing on outcomes that matter to us. It's about looking at tactical and operational solutions to staffing realities that are responsive to achieving our aspirational goals. Nursing is the nation's largest healthcare profession, with nearly 5.2 million RNs nationwide. Of those, 89% are employed in nursing, which translates to 4.628 million. The median age of an RN is 46 years old. More than 1/4 of RNs report that they plan to leave nursing or retire over the next 5 years. Employment of registered nurses is projected to grow from 5% to 2021 to 2031. And the federal government projects that more than 203,000 new RN positions will be created each year during that same time period. You know, the staffing churn that we're experiencing, the supply and demand challenges, the competency gaps we're seeing among new grad nurses has resulted in interruption of how we optimize, or how we've been able to optimize our workforce strategies. There's organizations who are having to double down on new grad clinical orientation, not just our residency program, because of what they're seeing right now. And the clinical gaps are becoming more challenging. with the turnover, there's a loss of experience. And in some cases, I'm hearing organizations where they don't have a lot of nurses who can serve in the role of a preceptor. We need to get to a place where we can once again optimize our workforce strategies and focus on building our staffing pipeline. How do we leverage technology to manage performance, and then develop the talent we already have? So today, my goal is to share with you some strategies that can be operationalized at your organizations. But I do want to spend just a few minutes with some background information before we jump into strategies. So let's chat a bit about why we're here. Our aspirational goals, perhaps, transform the nursing workforce. From Institute of Health and the National Academies of Medicine's Future of Nursing reports to the American Academy of Nursing's policy brief around transition to practice. These reports have served as a blueprint for the nursing profession and has given us directions on strategies to move forward. They give us aspirations and hope for the future. Healthcare has made progress in achieving quality and workforce development goals, and that's worth celebrating. However, our new environment demands a different way of meeting these goals. Last year, Becker's identified those listed here as the top 5 issues that healthcare will encounter. Foundational safety work that we need to get back to, supporting the healthcare workforce, purposeful efforts to protect and support the workforce both physically and psychologically, integrating equity into safety work. Diagnostic harm can be an issue with staffing shortages and chaotic work environments, healthcare associated infections. So these top 5 issues we have in healthcare now are not just remnants of the past, but have been heightened these last couple of years. The crisis we're currently experiencing will have lasting damaging impact if we can't pivot and operationalize new strategies. HRSA published a supply and demand projection in November of 2022, which is what you're seeing on your screen. I do want to point out that this modeling assumes that the historical patterns of attrition, graduation, and labor force participation remain the same over the forecast period, because these macro assumptions are very sensitive to incremental changes. Also, keep in mind that part of the data that was used was from the pandemic, and we have yet to see the full impact of it. Now, with this projection, this indicates that by 2025, the demand for RNs and LPNs will continue to surpass the supply until 2030. Nationally, there is a projected shortage of 78,610 FTE RNs by 2025 and a shortage of 63,720 FTE RNs by 2030. Now, by 2035, the supply for RNs might be more than the demand, with an excess of approximately 16,180 FTEs. Now, this is different, though, for LPNs. The demand for LPNs will continue to rise faster than the supply through 2035. There's a projected shortage of over 141,000 LPN FTEs by 2035, which only meets 83% of the demand. So given that there are new models of care being implemented, which includes increasing the number of LPN hires, we know that these numbers are going to change in the next couple of years. So for those of you who are in the state of Connecticut, and Marcia, thank you for sharing this data with us, this will be published later on today. The Connecticut Department of Public Health online nurse licensure system collected RN and LPN data in 2022. Of the 89,819 RNs that hold a nursing license, only 57.3 are actively working. And of that, 50.1% are employed in a nursing capacity within Connecticut. Of the 14,422 LPNs that hold a nursing license, only 69.3% are actively working. And of that, only 57.8 are employed in a nursing capacity within the state. So as you can imagine, even though the numbers tell us that there are many more who have carry active licenses. It doesn't mean that everyone's working actively or working in the nursing capacity. So let's shift our attention to attrition. In 2022, the general RN turnover in acute care settings is 27.1%, which is increased by 8.4% from the previous year. As you can see, the highest turnover is among nurses who've been in their organization less than a year. And this shouldn't be a surprise given what's happened in 2020 and 2021. So what is this costing us? The most commonly reported cost of turnover is $46,100, and we can all agree that this is a little low. You know, we don't consider the cost of premium labor in this data, and other factors should also be considered. I'm going to let you do that calculation for your own organization. You know what your numbers are. Just imagine what you can do with those dollars if there's a way to decrease the turnover. Earlier this year, AMN published the results of their survey where they polled more than 18,000 RNs nationally. And from this survey, there are 17% eligible to retire. Of those eligible to retire, more than 50% are looking to retire in the next 3 years. So again, yes, we have staffing issues, and then we also have that loss of experience and expertise that we need to consider. With the anticipated retirement of experienced nurses, the majority of our supply will be new grad nurses. And the post-acute care setting is seeing that new grad nurses will be a major hiring strategy for them. Hence the reason that there's this movement towards improving the exposure of nursing students in the post-acute care. Now, according to the latest data from AACN, there's a decrease in enrollment among RN to BSN and entry-level baccalaureate programs. And unfortunately, qualified applications continue to be turned away. And I'm sure you're not surprised about the reasons as to why those applications are being turned away. It's lack of faculty, lack of clinical sites, preceptors, and even classroom space sometimes. So we're in this perfect storm again. And I remember hearing about the perfect storm in nursing back in the early 2000s. And again, we're here. We have another perfect storm. We need to increase supply due to the aging population, increased retirement, high turnover. We can't produce enough nurses. And if there's not enough nurses to go back to school for higher education, we'll have a shortage of faculty, researchers, and primary care providers in the future. But there's always the sunshine at the end of the storm, right? So what is this path for us? Part of looking at this path for us moving forward is looking at our playbook. And some of the plays that we have need to be enhanced or are no longer sufficient. When I think about playbooks, there's always a scorecard. What are we going to measure ourselves against, and how do we know our strategies are working? So to me, it seems that given the challenges facing us, the two scorecards that are key to our success in the future are around sustainable staffing and our staff's ability to provide high quality care. So let's talk about sustainable staffing. We need to have a granular understanding of our workforce. Proactively projecting your workforce needs is critical when you're looking at supply and demand issues. This is just a sample projection for the sake of our conversation. You know, I can't tell you how often I encounter situations where the future needs of an organization is not being proactively looked at. How many are looking to retire? How many are potentially going out on leave? How many are at risk for leaving? How many are going back to school? How many new grads are graduating from schools where these organizations get their new nurses from? So the nationwide workforce supply and demand projections will influence how we project the composition of our workforce. You know, as much as we want to hire experienced nurses, there just are not a lot available. So with new grad nurses being the majority of our hires moving forward, the question is, how do we attract them? How do we prepare them in our environment? And how do we keep them moving forward? So the point I'm trying to make with this graph is if we proactively project what we want our workforce to look like, it will help direct our hiring and retention strategies. And we will expand on this a little bit later. The other thing that we should be doing and evaluating on a regular basis is understanding why our nurses intend to leave. For example, this correlation diagram published in Nursing Economics identified factors that are the strongest predictors of turnover intent. Conditions of work effectiveness, this looks at whether the nurses feel that leaders see their performance and how they're contributing into the organization. So strategies may include looking at meaningful recognition of nurses for their work, not just any rewards. They really don't want any more group recognition. Each nurse wants to be recognized for contributing back to the organization. Organizational commitment looks at whether nurses are willing to put extra effort into their work. Do they take pride in the organization they work for? If nurses don't feel prepared or competent to care for their patients, they're not as willing to take on any job assignment. And also it decreases their commitment to the organization as a whole. So if they're being asked to care for a new patient population, make sure that they have the resources they need to care for the patients and that their performance is validated. Satisfaction looks at satisfaction with salary, overall satisfaction with work, and satisfaction with nursing colleagues. I would recommend consider establishing a form of debriefing self-care groups where nurses can share their experiences and share resources. This gives them an opportunity to learn that they're not alone. Provide opportunities to build relationships with each other so they can be each other's support system. Now, I'm sure you're all familiar with reasons for why nurses are intending to leave that have been published out there. So as you can see, between surveys, we collect at Versant among new grad nurses, the American Nurses Foundation, and the American Nurse Association COVID-19 Impact Assessment Survey, and then the McKinsey Workforce Survey. The major reasons for intending to leave are very similar. It's about safety and the ability to deliver quality care. It's about meaningful work and development opportunities. It's about having the support within the work environment. These factors will be threaded throughout the rest of our conversation today. Here's a feedback from a nurse with 2 to 3 years of experience at their organization when asked about what the organization can do to prevent them from leaving. There's a voiceover, so I'm going to play it and hopefully you can hear this.
Upper management could support the nurses and listen when we say it is unsafe. We are working so hard all the time, even the strongest nurses are burning out at an alarming rate. My manager/director is amazing, but they are not supported by those above them. It is clear that the CNO and president are out of touch with reality and the staff is fully aware of it. They are actively driving this facility into the ground.
Yep.
You know, this is a tough one, and yet we have to be cognizant of the fact that one nurse took their time to write this very specific feedback, and there's always a chance that this one nurse may be sharing their perspective with other nurses on their unit. There's also a possibility that more than one nurse feels this way. Now, when we collect feedback, most of the time, we know what to expect. There are rarely any surprises. We know there will be negative feedback, and we're hoping for many positive reactions as well. When I first saw this particular one was a punch in the gut. How do we as nurse leaders respond to this? We may even question the validity of this comment. Are the leaders of this organization actively driving the facility to the ground? I can't imagine they are, but here's the thing. It doesn't matter whether I think, either as a Versant representative or as a leader in the organization, that this comment is right or wrong. This is the nurse's perception. There's a sense that their direct line supervisors are not being supported by those at the executive level and that the CNO and president are out of touch. You know, presenting data with uncomfortable truths like this is never easy, but we have to remember that what's important in collecting the data is so that we can develop strategies around areas that can be addressed, but also recognizing that there may be some factors which you had no control over. When you gather data and you develop strategies to address issues, communicate more than just what those new strategies are. What I'm hearing from many nurses is sometimes there's strategies that are being implemented, but they don't necessarily tie that back to a feedback that they have shared. Tie it together for them. Sometimes the strategy, again, is a different way to address the problem, but it's not automatic for our team members. We have to connect the dots for our nurses. As important as it is to understand why nurses are leaving or intending to leave, we must also understand why our team members are staying so that we can leverage those reasons. Among recent new grads who've completed a transition to practice program in the last year, most stay because they feel like they're able to provide high quality patient care. They have the flexibility to manage their schedules so that it's easier to care for their families, and having a transition to practice program. So these reasons of why they're staying is similar to why they're intending to leave, right? If they're not able to provide high quality care, they have a higher intent to leave. If there's no flexibility, they may look somewhere else. If they're not supported through their onboarding, they don't have the support in the work environment. So conducting stay interviews would be helpful in understanding what's important for them. Dr. Rose Sherman has a blog called Emerging RN Leader. If you haven't subscribed to it, it's free. I would recommend that you do. She always has some great strategies in her blog. And recently she shared some questions to ask during stay interviews, from what do you look forward to each day when you commute to work, to why do you stay here? What can I do to make your job better for you? So these are very simple, but will give you a lot of data and information about why your nurses stay. And feel free to add in the chat what other questions you ask for those of you who are already conducting stay interviews, so that we can share those with our colleagues here in this session. So another strategy I want to discuss in addressing our workforce pipeline is about priming the pump. First and foremost, if we're looking at priming the pump, we must engage the future generations of nurses. This is part of the same survey I mentioned being published by AMN earlier. And one of the questions asked was, how likely are the respondents to encourage others to become a nurse? I remember when I decided to go to nursing school right after high school, many family friends who were nurses themselves discouraged me from going into nursing. They said, nursing is no longer a good profession, you're on your feet all day, there's new diseases and viruses, and you're not paid well. First, I'm really glad I didn't listen, because I can't imagine myself being anything else but a nurse. And nursing has given me so much more than I can ever give back. What I want to point out in this image here is a 10% decrease in the percentage of respondents who are extremely likely to encourage others to become a nurse between 2021 and 2023. So how can we expect that the future generations will go into nursing if the narrative is that we're not recommending nursing any longer? Some of you may remember the initial Johnson & Johnson campaign for nursing's future back in the early 2000s to help tackle the nursing shortage. And that campaign was so effective in attracting more people into nursing. As leaders, we have a responsibility for changing this narrative of nursing no longer being a good profession. Let's role model behaviors and encourage others to consider nursing as a viable profession. We have to take the lead in engaging the future generations of nurses. That's one way we can begin priming the pump. This may also mean going out to middle schools and local high schools to share the benefits of working in healthcare and of being a nurse. You know, prior to the pandemic, I used to volunteer at the local middle school during their career days, and I would visit a class of about 30 to 35 6th and 7th graders. I had a short PowerPoint presentation. I had pictures of an ER nurse, a home health nurse, an executive, a nursing school professor. And there's always two surprises for them. One is that there are many career pathways within nursing that they didn't realize. And two, there are more male nurses than they realize. And they're always so excited after the presentation. And I just love the way their eyes lit up about nursing. And we need to go back to that. There's a lot of changes in schools lately, so I'm actually doing another presentation for 6th and 7th graders via Zoom, so we'll see how effective that is. But we need to introduce nursing as a great profession to belong to, instead of what we sometimes hear in the media, that nursing's no longer a good profession to be in. Enhance your academic practice partnerships. Focus on providing experiential learning to develop skills and competencies for practice. Focus on skills and competency acquisition during their clinical rotations or externships. There's been a few publications that shows that focusing on specific competencies that the clinical practice expect for them to come out with at the end of nursing school has been shown to shorten the clinical preceptorship time during onboarding. Link the last year of academic preparation to the clinical practice environment where these nurses will enter practice. So as much as possible, if these student nurses are going into an ICU, for example, if you can focus their clinical practicum during that last year in the ICU so that they can begin enculturation into the organization. This exposes the new nurses to the organization's culture earlier, improving retention and potentially decreasing the time that they need for their preceptorship. Support educational pathways, engage in discussions at the local, state, and federal level that promote opening of pathways for those aspiring to be nurses, CNAs to LPNs to ADNs and BSN and higher. You know, as employers, we have a tendency in time of crisis to just bring in bodies. We have become passive employers, and including myself, we can be desperate at times in trying to bring in people. We can get stuck in this cycle of hiring, quitting, job openings, and unfortunately, when there's a lot of job openings, we relook at salary. So this cycle contributes to wage escalation that's not sustainable in the long run, and we need to stop and think a little bit differently. You know, we face a very different workforce, and our recruitment strategy needs to address the type of employees you're targeting. McKinsey, for example, describes 5 different employee personas. Traditionalists, which is our main labor pool, these are the people who didn't quit their jobs during the Great Resignation. They're not risk takers, so most likely they won't leave until they already have a job lined up. A common recruitment strategy will work for them, such as higher compensation. The do-it-yourselfers, these are those who are between the ages of 25 to 45. They value work flexibility, meaningful work compensation. They left their jobs during the pandemic because of work-related stress, toxic managers, and feeling of not being appreciated. So strategies to attract them offer flexibility, autonomy, and a sense of purpose. The caregivers and others, these are those between 18 to 44. They're motivated by compensation, again, workplace flexibility, support for employee health, well-being, and career development. Idealists are the students and younger part-timers between 18 to 24. They're also looking for flexibility, career development, advancement potential. Compensation's a little bit lower on their list, but inclusivity and diversity is very important for this group. They like the day-to-day interactions that build a high-quality culture. And last but not the least, the relaxers. I have colleagues who've recently started saying that they're in preferment. Retirees who are not necessarily looking for work, their career doesn't come first anymore, but they are looking for meaningful work. And some have been enticed by high wages, considering the inflation. So far we've talked about granular, having a good understanding of your workforce. We talked about how we prime the pump. So let's talk about onboarding. You know, I've been in this transition to practice space for more than 20 years, and although practice preparation has been a challenge for as long as I can remember, these past several years have been exceptionally difficult. As I have conversations with educators, managers, directors across the country, I hear some of the common themes. Something is missing from our current transition to practice or a new graduate residency. We need to do something differently, or our current program just needs a change. So whatever clinical practice gap there was prior to COVID has just become more visible. Some nurse leaders have expressed how new grad nurses are lacking some basic skills even after their transition to practice program. I'm hearing challenges about communicating with the interdisciplinary team. You know, one thing I hear often is just the lack of an integrated approach between the new grad residency and the validation of performance in clinical practice. And this is prompting educators to reevaluate their current new grad program. They're looking for a framework to support the onboarding of new grads, because what they're saying is that the monthly meetings or the education sessions are no longer sufficient. We have to get to a point where we're not only providing a competency-based education, but there's an actual assessment and validation of performance tied to what they're learning during their residency. New grad nurses need concrete roadmaps for how to develop their competence. We need to look at habit-based approaches to ensure that our new grads can perform competently. And so, you know, we know that some of these challenges were due to the fact that not all new grad nurses who graduated from nursing school had completed all their required clinical hours, or a lot of them were completed via simulation. And then there's also a lot of restrictions of what nursing students are allowed to do during the clinical practicum. So part of this strategy is related to what we discussed earlier of how do we enhance academic practice partnerships so that the student nurses can gain the clinical experiences and practice that they need. A robust onboarding strategy often equates to costs. Onboarding and workforce development is almost always categorized as a cost instead of being recognized as an investment. Yes, implementing a competency-based onboarding strategy is about safety and quality, but we're trying to make an efficiency argument here because efficiency equals dollars, right? So if the issue we're trying to solve is how do we staff our organization, how can we use a competency-based strategy and leverage the available technology to help us with this? With using technology, you have the ability to improve inefficiencies inherent to the onboarding process. You know, when we onboard new team members, whether they're new grads or expert clinicians, we've made an assumption that they know nothing or they already know what to do because they're experienced, and that's how we provide the orientation or education. Let's focus on the competency-based onboarding because it's an opportunity to create a process for, one, identifying clinical practice gaps that may exist among your new hires, and whatever education you provide can then focus on remediating those gaps. So we're not educating the things that they already know, and then we're focusing on what are those areas that we need to improve on. I want to emphasize that competency-based education should not replace the demonstration and validation of performance during the much needed experiential learning and reflective practice opportunities. You know, if we know what the gaps are, the preceptors can also focus on validating performance that are ready and they're not having to wait. And we need to minimize the amount of clinical orientation time, but not sacrificing quality. You know, all of us in this room know the benefits of transition to practice programs, but again, this is also perceived as a cost, right? This programs should also be competency-based rather than time-based. Time is a factor for budget considerations. However, if we focus on competency development, we'll find that some new grads can perform and reach competent performance faster than others. So if we focus on competency-based onboarding rather than time-based, we can hire fast, we can rapidly deploy them without sacrificing quality. This goes for the precepted experience as well. Focus on the competencies needed by the preceptor. How do we enhance the way that they're teaching so we're being more efficient in this process? So let's move to our next strategy. We've primed the pump, we've onboarded. How do we now develop the talent that you already have? You know, we can't ignore the fact that the rapid movement of staff between specialties have impacted the workforce. And this happened a lot during the pandemic. It still continues. There's changes in care models, there's restructuring of units, there's bed expansion. I was just talking to someone last week and they're closing one unit, moving everything to the floor below because they needed more beds, which means that their nurses need to acquire new competencies because they're adding new patient population. So as I think about the movement of staff between specialties, I think about the variability in performance and competencies represented by this graph that you're seeing. So we can treat this graph as a representation of an individual nurse, and each bar is a competency that each nurse is required to perform. Based on their preparation and experience, they may be performing at the advanced beginner level or an expert level. We can also look at this a little bit differently and treat this graph as a representation of an entire organization and each bar as an individual nurse with varying levels of competence. So as we're developing our workforce, how do we ensure that we're minimizing the variability in practice? Competency performance impacts quality. So as you're looking to develop your workforce, create a structure that would assist you and gather to inform you or your team members' performance before you deploy them into the new areas. Do they have the knowledge necessary? Can they perform the skills and competencies? If not, provide opportunities to reskill as needed. Create opportunities where they can develop or gain new skills. If there's time to rotate through areas with different patient types or higher levels of care. If there are opportunities for cross-training between specialties, ensure that they're aware of this development opportunity. You know, awareness is such a big concern for many of the nurses, and that's very similar in terms of professional development as well. Most of the nurses I speak to don't realize the amount of professional development opportunities they have in their organization. Set up professional development pathways for your staff so that they can see that there's a future for them. Remember earlier, caregivers and idealists are looking for professional development. Assign them mentors, implement or make sure that they understand your clinical ladder program. So whatever resources that you have for your team members, whether it's about professional development or providing a way for them to engage in evidence-based projects or any other opportunities like that, make sure that they're aware of it, because it's the awareness that's preventing them from participating and from investing back into the organization. We can't end this presentation without at least briefly talking about some strategies on how to support your well-being. There are many resources for us as healthcare leaders on how we can support the well-being of our workforce. I just want to emphasize that these strategies also apply to all of you who are expected to support others. If you're not caring for your being when your being is not well, you'll not be able to do what you want to do for others. So take these recommendations and see how you can also explore some of these strategies for yourselves. The U.S. Surgeon General had published this framework for workplace mental health and well-being last year in recognition of challenges many healthcare workers have faced, everything from strategies on how we can support our workforce, protection from harm, including prioritizing physical and psychological safety, connection and community, work-life harmony, mattering at work, engaging them in workplace decisions as much as possible, and finally, opportunities for growth. Again, this is something that we saw as reasons for intending to stay and intending to leave when there's no opportunities for growth. There are many best practices that have been published focused on reducing stress for nurses, and here are just a couple of resources for you. The latest edition of Nurse Leader, August 2023, has these two articles that might be helpful. The first one has been implemented by the team at Emory. It's called the Embrace Program. It's a peer support program focused on establishing personal connections and identifying workplace culture that merits change, and they do this together. The other article is Common Spirit's Wellbeing Framework. This framework allows the organization to prioritize the internal and external factors that impact well-being and guides those interventions. And then also AONL has published their 3-part nursing leadership compendium. The second section discusses some strategies for wellness and well-being. So I'm going to end with a brief discussion of psychological capital, which looks at hope, efficacy, resilience, and optimism. HERO. There are many interventions available in the literature. Power of Joy, for example, is a good resource. Positive psychology has some very helpful strategies. So, for example, to help maintain or develop a sense of hope, one strategy to consider is helping your nurses with goal setting. Help them break down their goals so that they're achievable. They may say to you they want to become a charge nurse, but how do they get there? What are the specific steps? How much time would it take? Efficacy, which looks at whether the nurse believe they can take actions to drive results. Help them, remind them about their past successes, engage them in conversations, help them by reframing negative experiences. So instead of treating the experience as an obstacle or failure, help them look at what opportunities they now have. Resilience looks at the ability of the nurse to recover from after facing adversity, help remind them about what is their tie to purpose, why are they here, and there's an opportunity here to teach them how to cope with situations. And lastly, optimism, help them focus again on their successes and encouraging them to look for positivity in every situation. You know, as leaders, we'll always have fires to put out. Things are hard right now, things are difficult, and getting started with our strategies, it doesn't require full implementation of programs. It's really about progression. Start with structure, then process, and build it out as you go down your path. Our responsibility is taking the data, sharing the data, and helping the decision makers, those signing the checks, understand that the reason you have the outcomes you have is because of the structures and processes you have put into place. This path forward will require us to rethink our strategies about how we attract and retain the workforce. It's not always going to be easy, but it'll get us to our collective goals around sustainable staffing, high quality care, and financial stability. You know, I continue to believe that we are in the best position to be innovative and disruptive even. We just need to push ourselves outside of our comfort zone, out of our boundaries, push that circle we have created for ourselves just a little bit larger. I just want you to remember that transformational change sometimes starts with incremental steps. And when we do that, we'll ultimately reach our outcomes by leaps and bounds. Thank you for your time. And I think we can open it up for Q&A, Marcia.
Thank you, Larissa, for this wonderful overview. I know it was comprehensive and you had some fabulous statistics, and people had asked if the slides were available, and we will post the recording and the slides on the Connecticut Center for Nursing Workforce website. One of the, just a reflection that one of our participants had, they said the educational aspects concerns her. Staff shortages create extra stress on the practicing nurse, but hiring nurse educators to train new nurses is a huge challenge for those in education. Any reflections and thoughts as you work with clients around the country of how they're addressing that pinch point?
Sure, that's a really good question. And I think in addition to hiring educators to teach the new graduate nurses, there's also the challenge of we don't even have enough preceptors to teach the clinical practice once they're on the unit, right? Many of the organizations, some of the best practices I've seen is actually using new graduates who have gone through a transition to practice program earlier during their orientation as a way to at least help with some of those educational and skills needs in the very beginning. Starting an IV, doing some of the basic skill sets. So spreading the wealth almost, and not just asking educators to do all of the teaching. I've seen some organizations where they would ask the new graduate nurses to do a group teach, for example, where everybody takes in a topic and there's a facilitator. So it engages the new graduate nurses into the conversation as well. There are some opportunities where they would ask nurses who are in preferment. Remember earlier when I talked about those nurses who have recently retired but still really want to be engaged in the organization. We have some organizations who reached out to those who just retired but still want to continue to engage.
And I think you shared the full spectrum of who can be supportive in the process and in what roles they can be supportive And I think that huge preferment concept, or those potentially who are retiring much earlier than I'm sure they anticipated due to personal situations, could be a wonderful population to tap into.
Exactly. The other piece too that I have seen is the development of academic practice partnerships. So we have some organizations where they would tap into the educators at the universities to assist with some of the education as well, and then vice versa. The clinical practice site can serve as the preceptors, and they can then be given some training on how to teach or precept the nurses who are still going through school.
Right. Thank you, Larissa. Another question came to me directly in the chat. You had talked about how our nursing leaders in practice can actually begin to put together a plan so they can look at their overall costs of their labor and increase quality while reducing cost over time. And you had alluded that there's different employees being paid different wages. Any more insights on that, of how our nursing leaders in practice can really start to put together a plan to maximize their human capital in nursing?
Sure. One thing that we try to do with an organization who even wants to look at, well, what is going to be the return on our investment? How do we justify this? Ultimately, whenever you are implementing a workforce development program, the question you'll always get is this worth it? And how do you justify this? And is what we're paying, are we going to get a return on our investment? So part of it is doing an assessment and collect the data among your nurses of what I had discussed earlier, right? How many are looking to retire in the next couple of years? How many people are going on leave? How many are going back to school? If you can anticipate what those numbers are, and then also looking at what is your goal? For some organizations, they want to decrease their travelers, for example, by 5%, or some of them, they know they're always going to have the travelers. So understanding the composition, that your goal composition would help you begin targeting how many new grads you want to hire, how many experienced nurses you want to hire, and then also even what kind of experiences. You may have an experienced nurse coming from, let's say, a skilled nursing facility transitioning to the acute care. What would that look like? You also have to think about their experiences and what that length of orientation. And again, I can't emphasize enough, using a competency-based precepted onboarding will help you minimize the time, because you're focusing on performance. You're not focused on time. You're not focused on everybody gets 6 weeks. Can they perform successfully in 4 weeks? If they can, let's hire fast, deploy them fast. So that's where the efficiency comes in.
Thank you. I appreciate the feedback. If you'd like to unmute yourself, if there's a question that you did not type into the chat, but would like to get Larissa's feedback or maybe a little more clarification to what she shared, feel free to unmute and pose your question. Well, I am actually not hearing any at this time. Larissa, I do want to thank you so very much for sharing your expertise, really beginning the conversation, and how we both in academia and practice need to partner together to really see how we can address the key issues. You had some startling statistics early on in your presentation. And I know from the Workforce Center, our organization, we are publishing our workforce supply data for pre-licensure RNs and LPNs, our RNs and LPNs, and then publishing our education data related to pre-licensure RN and LPN, both faculty and student demographics. So that's going out this week and will be posted. So I think our work is cut out for us as a state to really determine what is the need from all levels of education? And we didn't even mention APRNs today,
Right.
which is a huge provision of care provider. So I think our work is cut out for us with these strategic questions as we move forward to do some problem solving. So again, thank you for your time. Any closing word before I close the session?
I just want to thank you all for being at this presentation. Like what Marcia said, the presentation is going to be available. My phone number and also my email is in the presentation. Feel free to get in touch with me if you have any questions or anything that you would want to explore further. That presentation is so packed with information, we could probably be talking about one topic for an hour. So please feel free to reach out to me.
Again, thank you, Larissa. And for those on the session, please do keep your eyes open for a survey, our evaluation. And once complete, you'll get your CE certificate. And we can't thank you enough. We will be having more lunch and learn scheduled for later on in the fall. And just a quick FYI, we do have a healthcare full day regional simulation workshop coming up October 27th. And that's going to be held at Fairfield University. So any simulationists and faculty, we welcome you to that full day program. And actually, the Connecticut Center for Nursing Workforce has free tuition. So feel free to reach out to me if you'd like to explore that opportunity further. We do have our student day coming up, and that's November 7th. And after 3 years of being on hiatus and doing it in a multi-day virtual format, we will be back at the AquaTurf with actually, I think we're going to top about 700 nursing students and our exhibitors and sponsors. So if you aren't part of that day and we want to be part of that day and meet 700 graduating senior RN students, we'd love to hear from you as well. So feel free to reach out to Peggy. And again, thank you for your time and have a wonderful afternoon.
Bye, everybody. Thank you.